Question, if I can, do you pronounce the name Miss Reich? R-E-C-H, Reich, like R-E-E-C-H, right? We have a colleague from Idaho who doesn't know how to pronounce his name either. He spells it the same way. So I have a question. I want to start off with you, if I may. We're grateful that you're all here. Dealing with federally qualified community health centers with respect to increasing access to behavioral health care. I'm a huge proponent, have been ever since I was governor, even before I was governor. Huge supporter of federally qualified community health centers. We have them in each of our counties, and they do wonderful work in a variety of ways. But I call them federally qualified community health centers. I don't even use the acronym, but I always have. But they play a critical role in our state. And increasing access to care. My notes here say to everyone, not to everyone, but to a whole lot of people. And we are, and that's particularly in rural communities, but not entirely, there are many rural communities in the state of Delaware, and I'm proud to serve as co-chair of something of we call the Senate Community Health Centers Caucus that you may have heard of, along with my fellow co-chairs. Listen to this: Senator Cardin, Senator Cornyn, Senator Cassidy, and Senator Carper. What is similar to all those people is the letter C. The letter C, there you go. I like to say the letter C defines, that tells people that seekers to a happy marriage communicate and compromise. But also, that the letter C can be used to apply to getting things done here in the Senate. And the four names I've just mentioned are people who like each other, bipartisan, bicameral, and we get a lot done. But the services provided by federally qualified community health centers go beyond one's physical health. They also provide crucial services, as you know, for mental health care and treatment, not only in Delaware, but in the other 49 states as well. I oftentimes say, as Ms. Senator Cardin will attest, find out what works, do more of that. I used that just this morning in a hearing on permitting processes. But find out what works, do more of that. In that spirit, Ms. Reich, could you just share with us some of the best practices from centers that are doing an especially good job providing mental health services and addressing behavioral health needs of rural communities so that the rest of us can learn from their success? Find out what works, do more of that. Go ahead.
Well, thank you so much for the question, and thank you for your support of community health centers. So we have just implemented behavioral health at our health center about 2 years ago.
Where, again, tell me again more. Where is your health center?
Eastern Shore of Maryland, so Caroline County is our headquarters. Okay. And you know, when we think about our mission, providing that access to the comprehensive care that's integrated, you know, not providing that behavioral health service was a barrier for our patients. And so bringing behavioral health into the health center was very important because we ensured that it was integrated with primary care. And so through the course of the patient care day, if one of our medical providers was treating a patient and did some of the screening tools that we use, the SBIRT screening for substance use disorder, depression screenings, et cetera, we connect the patient with a behavioral health therapist right then and there through a warm transfer. And so what we have found with that warm transfer process is the patient is in a place where they're ready to get into treatment. They likely show up for their appointments, and they are getting better. And that's what we want to do. Also take away some of the stigma, too, that the behavioral health is right there co-located with our medical, with our dental as well. So I think that integration is really key, and then ensuring that we do those warm transfers as well during the course of the visit. So that's some of our lessons learned as we've moved forward with behavioral health care at Chop Tank.
Well, that's good. I have about 30 more seconds. That's probably not enough time to ask another question, so I'll just sit back and listen to Senator Barrasso, Dr. Barrasso's question.
But do you have any Delaware patients that come into your facilities?
Yes.
I thought Senator Carper would like to know that.